Good morning. This video is about embryo culture in a humid or a dry environment. Which is best? The question arose to me when I was watching a video from Biotech, looking at in their reference library. The video was on 3 trending topics in embryology, and this slide caught my eye, looking at the impacts of dry or humid culture. And as the speaker was saying, you can, in your embryo culture, which is usually small drops in a petri dish covered with oil to stop the drops from evaporating, and then it's put inside these small incubators. This one's a little plug for the Biotech incubator. The dishes sit in these individual chambers, and there is gas that is purged through, containing 5% CO2, and that gas can either be humidified or it can be dry. And a lot of people like to avoid water because it avoids fungal contamination and allows a faster recovery of the pH when the dish has been out. But if you don't have a dry culture, then you have evaporation and increase in osmolarity over time, which causes embryo problems. So I thought I would look at that, and there is the YouTube link for the Genea YouTube video. By way of always, this is a welcome and a disclaimer. My name is James Danger. I have a PhD in embryology with more than 50 years experience. The videos for this channel are my attempt to bridge the gap between information you may need for your fertility treatment and the most recent publications available to your clinic staff. I'm not a medical person, and this information is not medical advice, but it may help you in knowing what questions to ask about your treatment with your doctor, and maybe to help in understanding the advice that you receive. As always, this page has been dedicated to a future supporter of IVF Daily. I'm just starting out, but if you'd like to promote your company or clinical product, this may be a place where you might like to consider doing that. But in supporting the channel, it might mean that an IVF client may well become a better informed client. You can click subscribe, or just become a sponsor, or you can just make a donation to help others on their fertility journey. You can support my endeavours by donating to my GoFundMe page, or subscribe to IVF Daily Patreon CPD programs. So let's go to this first paper. The graphic. This was by Jason Swain in OBM Online in 2019. It's an excellent paper, and it's discussing the concept of continuous culture. It's come from a background where clinics were moving from sequential culture to the same continuous culture for 5 days, and moving from an incubator where the dishes are taken out every time to be assessed to a continuous time-lapse culture. And so the benefits of uninterrupted embryo culture, as he points out, include reduced dish removal from the incubator and more stable conditions, gas and temperature, reducing cell handling, accumulation of beneficial autocrine and paracrine factors released by an embryo. That has more benefit when you used to do group cultures, not so much when you're doing individual cultures. The concepts are compatible with all new types of time-lapse incubators, and there may be an increased workflow in the lab with less staff time and possible cost savings in not handling the dishes as much. But the risks are all to do with the media. The early ones were to do with media degradation, mainly the build-up of ammonia. But there may be some missing possible important embryo morphological indicators or signs of culture issues. You may find there's accumulation of volatile organics in the oil, and there may be immediate evaporation, changing the osmolarity, pH, and other solute concentrations in a dry incubator, and also the mineral oil may degrade. And he provides 4 graphs for you to look at. The first is just looking at the pH of a media that's under oil, where over a long period of time, this is in minutes, about 200 minutes, there's no real change in the pH, but if the dish is not under oil, the pH rises very quickly. The second one is to do a dry and humidified environment, looking at the change in osmolarity, and you can see here, if the dishes are cultured over 5 to 6 days in a humid environment, there's virtually no change in the osmolarity. But if you're using a gas flow which has not been humidified, there is this constant and increasing increase in osmolarity. He showed two other graphs. One was using lid on or off, and with different sorts of mineral oil, and you can see that changing the lid doesn't make much difference. In other words, there's enough airflow in through the lid to affect the changes. And lastly, whether there's advantage in washing the oil or not, and clearly washing the oil over time doesn't make any difference. But if you want to look at some of the oil itself, here's a paper published in 2022 in Human Reproduction. And in that paper, they asked the question, are there significant differences between available commercial oil brands used in human IVF? And it is known that mineral oil is a critical component of the human culture system due to its protective and stabilizing roles during in vitro embryo development. Many different oils are available on the market with differences in their viscosity, density, and overall quality. And as a bit of a spoiler alert, as always, the summary answer is there are important differences that have been detected amongst the tested oils in their ability to stabilize culture conditions and, more importantly, on their direct effect on embryo development and viability. Basically, what they observed was there were significant differences detected in the rise in osmolarity and equilibration stability of pH between the oils, which could be correlated to their physiochemical characteristics, whether it's light or heavy, etc. In particular, oil samples with a higher viscosity tend to offer an additional protection against fluctuations of culture conditions. However, the differences in temperature stability between oils were minor. Worrying, 2 out of 13 oil samples which were commercially available were identified as embryotoxic by applying a highly sensitized mouse embryo bioassay protocol looking for toxicity. And also they could demonstrate between the different oils there were differences in the total number of cells and the number of cells in the inner cell mass, the blastocysts, between the groups. So looking at that, there's another paper published in 2019 looking at the unstable osmolarity in microdrops. In this group, the purpose was to study the stability of osmolarity in non-humidified and humidified incubators, and they concluded that mineral oil alone may not adequately prevent gradual changes in the osmolarity of low-volume microdrops during extended in vitro culture of human embryos in non-humidified incubators. As a result, the osmolarity may increase to levels high enough to cause stress to human embryos and adversely affect clinical outcomes. And they recommend that the stability of osmolarity should be given more consideration in embryo culture systems. They also noticed that there was a significant and linear increase was found in the osmolarity of 50 and 200 microdrops covered with mineral oil during 5 days of incubation in non-humidified benchtop incubators. The maximum increase was 20 milliosmoles per kilogram, and the extent of the increase was affected by the microdrop volume size and possibly the type of oil used to cover the drops. In contrast, the osmolarity of 50 and 200 microliter drops did not change after 5 days in a humidified benchtop incubator. So looking at that again, a bit more data, this is another article published in 2021, Human Reproduction, looking at what factors may affect embryo evaporation osmolarity. So in this paper, they asked the question, which lab-related factors may impact the culture system's capacity to maintain a stable osmolarity during human embryo culture? What is already known is that the culture media is a critical component in human embryo culture. Minimizing its evaporation during culture is an adequate strategy, it's a really important strategy, to stabilize osmolarity and as a result, improving culture conditions and clinical outcomes. And the answer always is the incubator humidity, the volume of mineral oil, the type of culture media, and the design of the time-lapse dishes have been identified as important parameters that can cause an impact on media evaporation and consequently osmolarity during culture. So the key points here from the authors were that one, that protein supplementation did not significantly affect evaporation, so you can't affect it by adding more protein. The humidity levels inside the incubator, the volume of the mineral oil, and the type of culture media all played an important role in osmolarity stabilisation. The design of time-lapse dishes and their recommended preparation protocols heavily influenced the evaporation rates, which were further altered by each of the incubator's characteristics. Media with initially high osmolarity had a bigger risk of reaching hypertonic levels during culture. So the dish impact caught my eye. I went back. This is a graph of the 6 dishes I tested. We don't know which dish it is, obviously, but you can see over 7 or 8 days, huge changes in osmolarity just on the dishes themselves. They make the point that the design of time-lapse dishes and their recommendation preparations protocols heavily influenced the evaporation rates, which were further altered by each incubator's characteristics. The threshold above which osmotic stress is triggered in vitro in the mouse has been described at about 300 milliosmoles, but this has not been identified in the human, but you could use that as the benchmark. And you can see for one dish C, after 5 to 6 days in culture, we're getting very close to that threshold. So I thought I'd just detail what the author had written. They wrote that of the total of 6 different models for commercially available time-lapse dishes, each of them with a unique design were tested, including the Primo from Vitrolife, the Embryo Slide from Vitrolife, the Embryo Slide Plus from Vitrolife, the 380 Special GPS from Cooper Surgical, Jerry from Geneo Biomex, and Cultural Coin from Esco Biomedical. Each type of dish was prepared according to its own manufacturer's instructions. All the dishes were cultured in parallel in the same dry benchtop incubator. The osmolarity was measured immediately after preparation at 72, 120, and 168 hours. So this is quite a scary thing that one wouldn't know which dish you were using and how it would be affected. There's one more paper I liked, or 2 more papers I liked. The second last was the impact on culture media pre-equilibration. And these authors argued there was increased osmolarity in dry incubators at 96 hours. There were more good quality blastocysts and more available embryos for transfer in humid incubators. However, the clinical pregnancy outcomes were not significantly different between oil using fresh and pre-equilibrated oil. But that's often the case, is that you'll always pick out the very best embryo for transfer, and maybe those ones will not be different in their ability to implant. And then they made an interesting point, which I wasn't able to follow up on. They mentioned that pre-equilibrating culture media overnight in humid-style incubators, even when covered with fresh mineral oil, significantly mitigates the osmolarity rise and improves embryo development potential during embryo culture in dry-type incubators. And that suggests that preloading the oil in a humidified environment before adding the embryo culture often will be sufficient for a dry-type incubator. And the last paper I need to cite is one that was published in 2022, looking at propensity scoring at embryo development clinical outcomes. This was also in human reproduction, which I think does an excellent job. Gee, I like that paper. The study question: does culture in high relative humidity atmospheres improve clinical outcomes when using time-lapse integrated incubators and single-step culture media? And the answer is, using integrated time-lapse systems and single-step culture media, culture in a relatively high humidity atmosphere increases the likelihood of embryos, especially those subjected to pre-implantation genetic testing for aneuploidies, to achieve a pregnancy compared to those cultured in dry conditions. So here we're talking, for the first time, we're talking about the impacts of different embryo management strategies on outcomes in dry and humid environments. And they argue that the embryos showed an overall faster development when cultured in humid environments, which has been related to high competency and implantation potential. Particularly early events showed especially significant differences between the 2 culture systems. So the effect between dry and humid was affected very early on in the first 1 or 2 cell cycles. The longer duration of the first cell cycle in dry cultured incubators might reflect an increased incidence of defects during cell cycle division and arrest. The time to reach the morula stage was also significantly faster in humid environments. And they provide full graphs. What's interesting here is, they had three different scenarios overall, cases just using young donated oocytes, normal treatment, and treatment using PGD-A. And they argued that embryos cultured in humid conditions are more likely to achieve a clinical pregnancy than those cultured in dry conditions. The effect is dependent on the type of treatment. No improvement in clinical pregnancy rate was seen with ovum donation or autologous treatments, although there is a difference there, but it's obviously not significantly different. But a statistically significant positive effect was present in treatments where PGD-A was performed. So just going on for that a bit further, and the authors make a point that as part of their PGD-A process, embryos often undergo assisted hatching on day 3, ready for biopsy on day 5. The assisted hatching protocol involves extraction of the embryos from the ideal culture environment of the incubator and their exposure to several laser pulses until the formation of a hole on the zona pellucida. But they also make the point that the mean oocyte age for PGT-A treatment subgroup was older than for autologous and ovum donation cycles, and that a humid atmosphere decreases media evaporation and the associated increase in osmolarity. Hence, the competence of embryos from PGT-A program already subjected to high levels of stress and derived from aged oocytes could further benefit from a less stress-producing environment associated with humid culture. Excuse me. The wider implication of this, which I thought was really quite interesting, was that support for embryo culture in conditions of high humidity contributes to optimized clinical results in undisturbed culture systems in a time-lapse incubator with single-step media. Culturing embryos in high humidity using integrated system increased the likelihood of embryos achieving a clinical pregnancy. Embryos showed faster development when cultured in humid environments, and they can conclude that high humidity optimizes this particular strategy, particularly with embryos undergoing PGT-A. Culturing embryos reduces the embryo stress, which in cases of age and PGT-A may support maximum development and viability. So you can culture in a dry environment, but your pregnancy rates may well be lower. And I'd like just to finish up on this slide, which is out of kilter with everything else, but this data comes from the MPSU dataset 2022 and looks at the clinical pregnancy rate per clinic for fresh autologous transfers, and its pregnancy rate per initiated cycle. And you can see there's an interesting spread of clinical pregnancy per clinic, and that, of course, could be due to the matrix of the patients and other aspects. But it wouldn't be interesting to know if clusters of groups with one using dry or humid environments or different sorts of dishes. There's a lot of things that have been raised in this review which require further investigations, and I hope they do that in the near future. So I'd just like to thank you both for persevering, and I recognise that IVF is a personal journey that involves the action of many people and many events, and it helps to understand all these aspects in your journey. I hope this information has been of value, and if you'd like more information provided, then tell other clinics about this service, and please subscribe. I will call it a quit. Thank you.